What happens if tPA treatment is delayed for stroke? Imagine a stroke happening suddenly, like a lightning strike in the brain. When that occurs, every second counts. If it's caused by a blood clot blocking blood flow, doctors often use a medication called tissue plasminogen activator, or tPA, to dissolve the clot and restore circulation. But timing is everything. The longer treatment is delayed, the less likely it is to help and the more likely it is to cause harm. tPA works best when given as soon as possible after symptoms start. The current guidelines generally recommend administering it within 4.5 hours. The earlier, ideally within 3 hours, the better the chance of a good recovery. After this window, the benefits decrease and the risks increase. This is because brain cells are extremely sensitive to oxygen deprivation. When blood flow stops due to a clot, brain tissue begins to die within minutes. tPA's role is to break up that clot, but it cannot revive dead tissue. So, the sooner blood flow is restored, the more brain function can be preserved. If tPA is given after the 4.5-hour window, several issues can arise. First, its effectiveness drops significantly. Studies show that beyond this time, most patients do not experience meaningful improvement. Second, the risk of bleeding in the brain, known as hemorrhagic transformation, rises sharply. This bleeding can worsen stroke symptoms and sometimes become life-threatening. Because of these risks, administering tPA late often results in no net benefit, and in some cases, it can cause more harm than good. Some patients are treated after the 3-hour mark because research indicates that certain individuals may still benefit within a slightly longer window. However, the greatest benefit is always seen when treatment starts early. Many hospitals have protocols to speed up diagnosis and treatment, such as stroke teams and rapid imaging, to minimize delays. Public awareness campaigns focus on recognizing signs like face drooping, arm weakness, speech difficulty, and sudden severe headache, encouraging people to seek emergency help immediately. Delays in treatment can have serious consequences. Every minute lost reduces the chance of a good outcome. For severe strokes, even a 10-minute delay can mean about 8 weeks of healthy life lost. That's why quick action is vital. The key is recognizing symptoms early and getting to a hospital fast. Medical professionals carefully weigh the benefits and risks of tPA for each patient, considering individual health factors and timing. But generally, the message is clear. The sooner tPA is given within the recommended window, the better the chances of recovery and the lower the risk of complications. Always consult healthcare providers for personalized advice, and remember, acting quickly can make all the difference in stroke treatment.